required to be in every single plan. And so states had to have a benchmark plan. There was one particular Blue Cross Blue Shield plan that was chosen as the benchmark plan. And so that's how the medal levels were designed from there. So let's talk about the federal poverty levels, which is what the subsidies are based on. And here's just a few examples of size of family unit, and you've got 100% of federal poverty level versus 400%. So at 400% of federal poverty level for a family of 4, that family can be bringing in $94,200 a year and still qualify for a subsidy. Now, here's what I want to point out. It's like a sliding scale. So this group over here is going to get quite a bit less in subsidy than up here. I forgot I have a fancy pointer. I could have just pointed. So it's on a sliding scale. But still, the good news is there are a lot of families that are going to get some help. Yeah, at first glance, and rest assured, I've heard a number of people say, well, that's a lot of money. Seriously? Those people are getting a subsidy? But when you have 4 kids in this day, when you have 4 kids in this day and age, there are a lot of families that are even making higher incomes and that are working 2 jobs that can't afford insurance. They may be able to afford the mortgage, they may be able to afford some of the other stuff, but they can't afford insurance. And so they're not paying for insurance, and they're letting their health go. And that's a reality. So they're going to get some help now. And they're not getting near as much help as everybody else, but they are going to get some help. And so it's a good deal. Those that are down on this end of the spectrum are really going to get a great deal of help. And they're the ones that really need it. They are the ones that have really been suffering and not been getting access to quality care and not been taking the medications they need to be taking. And they are really going to get some great help.